Don't stop. Don't stop.
Type 2 diabetes, DM*. Causes of type 2 diabetes. In a healthy person, the pancreas, an organ behind the stomach, releases insulin to help the body store and use the sugar from the food you eat. Diabetes happens when one of the following occurs: 1. When the pancreas does not produce any insulin. 2. When the pancreas produces very little insulin. 3. When the body does not respond appropriately to insulin, a condition called insulin resistance. Unlike people with type 1 diabetes, people with type 2 diabetes produce insulin. However, the insulin their pancreas secretes is either not enough or the body is unable to recognize the insulin and use it properly. Insulin resistance. When there isn't enough insulin or the insulin is not used as it should be, glucose, sugar, can't get into the body's cells and builds up in the bloodstream instead. When glucose builds up in the blood instead of going into cells, it causes damage in multiple areas of the body. Also, since cells aren't getting the glucose they need, they can't function properly. The role of insulin in the cause of type 2 diabetes. Your body is made up of millions of cells. To make energy, these cells need food in a very simple form. When you eat or drink, much of the food is broken down into a simple sugar called glucose. Then, glucose is transported through the bloodstream to these cells where it can be used to provide the energy the body needs for daily activities. The amount of glucose in the bloodstream is tightly regulated by insulin and other hormones. Insulin is always being released in small amounts by the pancreas. When the amount of glucose in the blood rises to a certain level, the pancreas will release more insulin to push more glucose into the cells. This causes the glucose levels in the blood glucose levels, to drop. To keep blood glucose levels from getting too low, hypoglycemia or low blood sugar, the body signals you to eat and releases some glucose from the stores kept in the liver. It also signals the body to lower the amount of insulin being released. People with diabetes either don't make insulin or their body's cells no longer are able to recognize insulin, leading to high blood sugars. By definition, diabetes is having a blood glucose level of greater than or equal to 1. Fasting blood glucose 126 mg per deciliter, mg/dl. 2. Random glucose level greater than or equal to 200 mg/dl along with symptoms of diabetes. 3. Postprandial glucose, a 2-hour glucose, level of greater than or equal to 200 mg/dl. 4. A1C greater than or equal to 6.5%. Diabetes must be confirmed by meeting at least 2 of these test criteria, or by repeating one of these tests on a different day. Health risk factors for type 2 diabetes. 1. Type 2 diabetes is believed to have a strong genetic link, meaning that it tends to run in families. Several genes are being studied that may be related to the cause of type 2 diabetes. If you have any of the following type 2 diabetes risk factors, it's important to ask your doctor about a diabetes test. With a proper diabetes diet and healthy lifestyle habits, along with diabetes medication, if necessary, can manage type 2 diabetes just like you manage other areas of your life. Be sure to continue seeking the latest information on type 2 diabetes as you become your own health advocate. Other type 2 diabetes risk factors include the following: 2. High blood pressure. 3. High blood triglyceride, fat, levels. 4. Gestational diabetes or giving birth to a baby weighing more than 9 pounds. 5. High fat and carbohydrate diet. 6. High alcohol intake. 7. Sedentary lifestyle. 8. Obesity or being overweight. 9. Ethnicity. Certain groups, such as African Americans, Native Americans, Hispanic Americans, and Japanese Americans, have a greater risk of developing type 2 diabetes than non-Hispanic whites. 10. Aging. Increasing age is a significant risk factor for type 2 diabetes. The risk of developing type 2 diabetes begins to rise significantly at about age 45, and rises considerably after age 65. Diabetes tests. if you experience symptoms of 1. Severe increased thirst, frequent urination. 2. Unexplained weight loss, increased hunger. 3. Tingling of your hands or feet. Your doctor may run a test for diabetes. 4. To confirm the diagnosis of type 2 diabetes, your doctor will order a fasting plasma glucose test or a casual plasma glucose. 1. Diabetes and the fasting plasma glucose test. The fasting plasma glucose test, FPG, is the preferred method for diagnosing diabetes, because it is easy to do, convenient, and less expensive than other tests, according to the American Diabetes Association. How do I prepare for the blood glucose test? Before taking the blood glucose test, you will not be allowed to eat anything for at least 6 to 8 hours. What happens during the blood glucose test? During a blood glucose test, blood will be drawn and sent to a lab for analysis. What do the results of the blood glucose test mean? 1. Normal fasting blood glucose or blood sugar is between 70 and 100 mg per deciliter or mg/dl for people who do not have diabetes. The standard diagnosis of diabetes is made when 2 separate blood tests show that your fasting blood glucose level is greater than or equal to 126 mg/dl. 2. However, if you have normal fasting blood sugar, but you have risk factors for diabetes or symptoms of diabetes, your doctor may decide to do a glucose tolerance test to be sure that you do not have diabetes. 3. Some people have a normal fasting blood sugar reading, but their blood sugar rapidly rises as they eat. These people may have impaired glucose intolerance. If their blood sugar levels are high enough, they may be diagnosed with diabetes. 1. The casual plasma glucose test for diabetes. The casual plasma glucose test is another method of diagnosing diabetes. During the test, blood sugar is tested without regard to the time since the person's last meal. You are not required to abstain from eating prior to the test. A glucose level greater than 200 mg/dl may indicate diabetes, especially if the test is repeated at a later time and shows similar results. 2. The oral glucose tolerance test for diabetes. The oral glucose tolerance test is yet another method used to detect diabetes, but it is usually only done during pregnancy to diagnose gestational diabetes or for someone who is suspected of having type 2 diabetes yet has a normal fasting glucose level. It can also be performed to diagnose prediabetes. 3. Hemoglobin A1C test. 1. The hemoglobin A1C test, also called HbA1c, glycated hemoglobin test, or glycohemoglobin, is an important blood test that shows how well your diabetes is being controlled. 2. Hemoglobin A1c provides an average of your blood sugar control over the past 2 to 3 months and is used along with home blood sugar monitoring to make adjustments in your diabetes medicines. Hemoglobin is found in red blood cells, which carry oxygen throughout your body. 3. When your diabetes is not controlled, meaning that your blood sugar is too high, sugar builds up in your blood and combines with your hemoglobin, becoming glycated. 4. The average amount of sugar in your blood can be found by measuring your hemoglobin A1c level. If your glucose levels have been high over recent weeks, your hemoglobin A1c test will be higher. 5. For people without diabetes, the normal range for the hemoglobin A1c test is between 4% and 5.6%. 6. Hemoglobin A1c levels between 5.7% and 6.4% indicate increased risk of diabetes, and levels of 6.5% or higher indicate diabetes. 7. Because studies have repeatedly shown that out-of-control diabetes results in complications from the disease, the goal for people with diabetes is a hemoglobin A1c less than 7%. 8. People with diabetes should have this test every 3 months to determine whether their blood sugars have reached the target level of control. Those who have their diabetes under good control may be able to wait longer between the blood tests, but experts recommend checking at least 2 times a year. 10. Abnormalities that can affect the results of the hemoglobin A1c include 1. Anemia. 2. Supplements such as vitamin C and E. 3. High cholesterol levels. 4. Kidney disease and liver diseases. Other diabetes tests, along with the hemoglobin A1c test, It's important for people with diabetes to have a dilated eye exam at least once a year as part of a complete eye exam. This important test can detect early signs of retinopathy. 2. Which may have no symptoms at first. A foot exam once or twice a year or at every doctor's visit. 4. Lipid profiles, LDL. Diabetes testing in children. Many children have no symptoms before they are diagnosed with type 2 diabetes. Most of the time, diabetes is discovered when a blood or urine test taken for other health problems shows diabetes. Talk to your doctor about your child's risk for diabetes. If your child's blood sugar tests are higher than normal, but not yet at the level of diabetes, called prediabetes, your doctor may instruct you in specific diet and exercise changes to help your child avoid getting diabetes altogether. Children with type 2 diabetes or prediabetes are almost always overweight or obese. Oral treatment for type 2 diabetes. Remember that people with type 2 diabetes tend to have two problems that lead to increased sugar, glucose, in the bloodstream. They don't make enough insulin to move glucose into cells where it belongs. The body's cells become resistant to insulin resistance, meaning they don't take in glucose as well as they should. In time, people with type 2 diabetes develop what's called beta cell failure. This means that the cells in the pancreas that make insulin no longer are able to release insulin in response to high blood sugar levels. Therefore, these people often require insulin injections, either in combination with their diabetes pills, or just insulin alone to manage their diabetes. Types of diabetes pills. Diabetes pills are grouped in categories. There are several categories of diabetes pills. Each works differently. 1. Sulfonylureas. They include glucotrol, glipizide, glucotrol XL, extended release, diabeta, glyburide, micronase, glyburide, glinase prestab, glyburide, and amyryl, glyburide. These drugs can cause a decrease in the hemoglobin A1c, HbA1c, of up to 1%-2%. Side effects of first and second generation sulfonylureas include hypoglycemia, low blood sugar, upset stomach, skin rash or itching, weight gain. 2. Biguanides. These diabetes pills improve insulin's ability to move sugar into cells, especially into the muscle cells. They also prevent the liver from releasing stored sugar. Biguanides should not be used in people who have kidney damage or heart failure because of the risk of precipitating a severe buildup of acid, called lactic acidosis, in these patients. Biguanides can decrease the HbA1c 1%-2%. An example includes metformin, glucophage XR, Riomet, Fortamet, and Glomet. Side effects for biguanide medications include upset stomach, nausea, diarrhea, metallic taste in mouth. 3. Thiazolidinediens. These diabetes pills improve insulin's effectiveness in muscle and in fat tissue. They lower the amount of sugar released by the liver and make fat cells more sensitive to the effects of insulin. Actose, pioglitazone, and Avandia, rosiglitazone, are the two drugs of this class. A decrease in the HbA1c of 1%-2% can be seen with this class of oral diabetes medications. These drugs may take a few weeks before they have an effect in lowering blood sugar. All patients using Avandia must review and fully understand the risks to the heart. Side effects for thiazolidinediens are rare but may include elevated liver enzymes, liver failure, respiratory infection, headache, fluid retention. 4. Alpha-glucosidase inhibitors, including precose, acarbose, and glycet, miglitol. These drugs block enzymes that help digest starches, slowing the rise in blood sugar. These diabetes pills may cause diarrhea or gas. They can lower hemoglobin A1c by 0.5%-1%. Side effects for alpha-glucosidase inhibitors include stomach upset, gas, diarrhea, nausea, cramps. 5 meglitinides, including Prandin, Repaglinide, and Starlix, Nateglinide. These diabetes medicines lower blood sugar by stimulating the pancreas to release more insulin. The effects of these diabetes pills depend on the level of glucose. They are said to be glucose dependent. High sugars make this class of diabetes medicines release insulin. This is unlike the sulfonylureas that cause an increase in insulin release, regardless of glucose levels, and can lead to hypoglycemia. Side effects of meglitinides include hypoglycemia, low blood sugar, stomach upset. 6-dipeptidyl peptidase 4, DPP4, inhibitors, including Januvia, sitagliptin, Nisina, alogliptin, Onglyza, saxagliptin, DOT, and Trajantat, linagliptin. The DPP4 inhibitors work to lower blood sugar in patients with type 2 diabetes by increasing insulin secretion from the pancreas and reducing sugar production. These diabetes pills increase insulin secretion when blood sugars are high. They also tell the liver to stop producing excess amounts of sugar. DPP4 inhibitors control sugar without causing weight gain. They may be taken alone or with other medications such as metformin. 7-sodium glucose cotransporter 2, SGLT2, inhibitors, work by blocking the reabsorption of glucose by the kidney and increasing glucose excretions in urine. The only drugs available in this category are Farxiga, dapagliflozin, Jardiance, empagliflozin, DOT, and Invokana, canagliflozin. Other drugs are being developed. Side effects of Invokana, canagliflozin, the SGLT2 inhibitor, vaginal yeast infections, urinary tract infections, dizziness, fainting. 8. Combination therapy. There are several combination diabetes pills that combine two medications into one tablet. One examples, Glucovance, which combines glyburide, a sulfonylurea, and metformin. Metaglip, which combines glipizide, a sulfonylurea, and metformin. Avondamet, which uses both metformin and rosiglitazone, Avondia, in one pill. Casano alogliptin and metformin, and Ozani, alogliptin plus pioglitazone, are other examples. Studies have shown that some diabetes pills may help prevent diabetes and diabetes-related complications. Both metformin and Precoz have been shown to reduce a person's risk of developing type 2 diabetes, particularly when combined with lifestyle changes such as a proper diet and regular exercise program. Actos has been shown to reduce the risk of heart attack, stroke, and premature death in those with type 2 diabetes.